Can plasma treat cancer? In short, yeah. Hello, my name is Greg Friedman. I'm a bioengineer focused on research in electric discharges as they apply to bioengineering applications like cancer treatment. Short answer is not yet. It's still a research area, but let's talk about it in some detail. When you say cancer, it's hundreds, if not more, different kinds of diseases: prostate cancer, brain tumor, lung cancer. So let's talk about them in kind of like classes. So I want to separate cancers that are stable and in one spot. So like internal tumor that's growing in one spot, metastatic cancers where the tumor begins to break and now you have pieces of the tumor or individual cancer cells floating around, versus cancers that are more on the surface, like melanoma, skin cancer, for example, or lung cancer, which is it's in your lungs, but it's closer to the surface, so it's not so difficult to get to, or esophageal cancers. So there are a number of possible applications of plasmas in oncological treatments. First of all, you can use plasma directly on the tumor. You can apply plasma directly, like taking an electrode and treating the area, and that's been successfully demonstrated in multiple preclinical trials. There is also plasma treatment of various fluids, like there's plasma treated water, has shown anti-tumor activity. There are plasma treatment saline, plasma treatment with additives like normal acetylcysteine, shows increased anti-tumor activity of plasma treated liquid. There's also a lot of research in plasma treatment of biological fluids like cell growth media, different kinds of cell growth media. So you could plasma treat a solution and then inject that solution. Plasma is also shown to increase immune activity. So if you have like a melanoma and you plasma treat, you have increased activity of your immune cells right in that area, which could potentially help an animal or a patient's body heal a tumor. Now, should you rush to Amazon and buy the first available plasma toy and go treat yourself? Hell no. There are a lot of quacky treatments out there. FDA is very much out on the subject still, but there are a number of companies that are actively working in this direction, us included. It's going to get to the hospital. It's just not going to get to the hospital anytime soon. And plasma is starting to gain a role of what they call adjuvant. I'm probably mispronouncing that word, treatment, as in it's a treatment that's combined with some other treatments. And there's also going to need to be a lot of training for medical professionals on how to use these things. So again, they're still research tools. They're actively being studied. There are hundreds, if not more, publications coming out every year in various journals. A lot of these publications are extremely high quality, very in-depth studies showing pretty darn good results. Now let's take a step back. Plasma is electric discharge. So you're ionizing air, creating a lot of reactive oxygen, reactive nitrogen species, electric fields, ultraviolet radiation. All of those have pretty strong influence on biological systems and on cells in your body. Funny trick question. I like to trick students with is how much free oxygen is inside of your body right now. Side question, I don't consider lungs to be inside. Yes, lungs are inside of you, but the outer surface of the lungs is open to air. So inside of your blood, oxygen is bound. There's no free oxygen floating around in your veins. And the moment you start oxidizing biological system, it responds. It has built-in responses to oxygen, to stronger oxidizers, to peroxynitrate. Plasma changes pH of the liquid that is treating, and biological systems respond to that. A lot of intracellular activity depends on gated ion channels, and when you have strong applied external electric field, you can depolarize those channels. So you're able to influence, like, for example, calcium channel activity inside of your cells by applying external electric fields. And, plasma is not the only way to do that. There are other medical research directions that study effects of just pulsed electric fields with rather successful results. So this is a new field in medicine so far. Knock on wood, the results are very promising, and hopefully soon we'll see it in a doctor's office. So if you have any questions about plasma in oncology or plasma in general, please feel free to ask them in the comments section below, and I'll see you in the next one. Peace.